Hello guys, welcome to part 1 of our unit on gastrointestinal surgery. Before I move on with the lecture, I'd like to add a disclaimer that I do not own any of the pictures or illustrations I've used in this lecture. So today we're going to be talking about the surgical anatomy of the esophagus. So firstly, let's get some orientation out of the way. Let's take a sagittal section of the body and look at it from the side. On the posterior most end, we can see the spinal cord. And on the upper end, in front of the spinal cord, we can see the pharynx, which continues down as the esophagus and keeps going down, passes via the hiatus of the diaphragm and enters into the abdomen to a certain extent. Now, on the central tendon of the diaphragm, we have the heart, which is resting on it. I'd say that in this picture, we can see the left heart. Now you would say, why am I calling it the left heart specifically? Because I can see the arch of aorta over here, which is why I'm saying that I'm looking at the left heart over here in front of the esophagus. And now on the upper end of the esophagus, I can see the larynx going down as the trachea, and we all know that the trachea bifurcates into the right and the left mainstem bronchus. So the mainstem bronchus I'm seeing over here is probably the left mainstem bronchus. Now the arch of aorta and the left mainstem bronchus are actually exerting some pressure on the esophagus behind it. And behind the esophagus, we have the spinal cord, which is immovable. So this results in a narrowing or constriction of the esophagus at this level. Now this constriction, we would call it as the bronchoaortic constriction. Similarly, there is some pressure being exerted on the esophagus when it's going via the hiatus past the diaphragm. This too results in a narrowing or constriction at this level, which I can call it as the diaphragmatic constriction or narrowing, or the hiatal constriction. Similarly, all the way at the top, over here we can see the muscles of the pharynx. Let's specifically concentrate at the cricopharyngeus muscle. And the lower end of this muscle exerts a certain pressure on the entry level of the esophagus. This results in the development of a sphincter, which we call it as the upper esophageal sphincter, which is formed via the cricopharyngeus muscle. So we see a total of 3 constrictions on the esophagus. One is at the upper esophageal sphincter. Next is the bronchoaortic constriction over here. And then finally, we can see the hiatal constriction over here. Now, based on these constrictions, surgeons divide the esophagus into 3 parts. So, all the part of the esophagus that comes before the bronchoaortic constriction is called the cervical esophagus. And all the part of the esophagus which comes before the hiatal constriction is called the thoracic esophagus, and all the part of the esophagus which comes after the diaphragm is called the abdominal esophagus. Now here we can see the divisions I talked about: the cervical esophagus, the thoracic esophagus, and the abdominal esophagus. Now let's talk about the blood supply of the esophagus. And the blood supply is divided into cervical, thoracic, and abdominal supply. Firstly, we'll talk about the venous drainage of the esophagus. At the cervical level, the cervical esophagus is drained by the inferior thyroid vein. The thoracic esophagus is drained by the azygous vein, both of which drain into the superior vena cava. The abdominal esophagus is drained by the left gastric vein, which reaches the portal vein and finally drains into the inferior vena cava. That's all for the venous drainage of the esophagus. Now let's talk about arterial supply of the esophagus. At the cervical level, it's supplied by inferior thyroid artery. At the thoracic level, it's supplied by the descending abdominal aorta, which gives direct and indirect branches to the esophagus. At the abdominal level, it's the same as venous drainage. It's the left gastric artery, but additionally, it's also supplied by the inferior pharynx artery. That's all for the arterial supply of the esophagus. Here are the list of abbreviations I have used in this lecture. And that concludes our lecture. Thank you for watching.